Hello and welcome to the Women's Centers. My name is Jen and I'm going to talk to you about your telehealth visits for the medication abortion, also known as the abortion by pill. After watching this video, you will understand the medication abortion process, including how to take your medications at home and what to expect afterwards. Your telehealth abortion will consist of one initial phone call, one live video visit, and 2 links to complete patient forms. The first phone call is a meeting with a patient advocate to complete an eligibility screening. In order to be eligible for a telehealth visit, you must be no more than 9 weeks and 6 days on the day of your clinician visit. You must be in the state where the clinician and clinic are licensed and can receive mail in that state or be able to pick up medications at the clinic. Complete a medical history screening and have no risks for ectopic pregnancy or contraindications to medication abortion. If you are eligible for a telehealth abortion, the advocate will review the rest of your information, discuss any lab work or additional testing you may need, answer all your questions, discuss birth control, and review your take-home instructions. They will then process your payment, schedule your video visit with your clinician, and schedule your follow-up assessment. This visit will take approximately 15 to 30 minutes. After this initial phone call, you will receive a secure text message and email to complete your forms and consents. It is best if you can complete your forms and consents as soon as possible after your eligibility screening, as they need to be completed prior to your video visit with the clinician. If you have any questions about the forms or consents, please write them down. You will have an opportunity to ask questions at your next visit. Completing the forms and reading the consents will take approximately 15 to 20 minutes. Your meeting with the clinician will be scheduled as quickly as possible after your phone call with the advocate. Your clinician will obtain your consent for abortion, confirm you are comfortable with your decision, and answer any additional questions you may have. Then the clinician will prescribe your medications from the online pharmacy or order your medication kit to pick up at our health center. The visit should take about 5 to 10 minutes. Your clinician will also confirm your scheduled follow-up visit. 5 to 7 days after you take the medications, you will receive a text and email link to complete your follow-up assessment form. You will be asked to answer a series of questions. Once we receive your answers, they will be reviewed and we will contact you with any questions or if it is determined that you need to return for an in-person checkup. If you do not receive a call from our office, then we have determined your assessment to be complete. The follow-up assessment is the only way that we know that the medications worked properly, so it is very important to complete that visit. You will need to confirm completion of the medication abortion by taking a pregnancy test 5 weeks after you started your medication. You should write this date on your take-home instructions. It is critical that you take the pregnancy test in 5 weeks because while the medication abortion is very effective, sometimes it does not end the pregnancy. And sometimes, even though the medication has worked, there can still be tissue or clots in your uterus. You should eventually pass this on your own, though your clinician may recommend additional medication or treatment depending on how you are feeling. Rarely, the medication can fail, and in that instance, you would need a procedure. If at any time you have any questions or concerns about the medication abortion process, please contact the emergency hotline nurse. They are available 24/7, and the number is listed on your take-home instructions. Your medication abortion kit should arrive in the mail 1 to 3 days after your telehealth visit with the clinician, or you may pick up your medications at our center. While you are waiting to receive your medications, prepare for your medication abortion by making sure you have overnight maxi pads, a thermometer, and a heating pad or hot water bottle. Your medication abortion kit should contain the following: 1 Mifeprex pill, 1 bottle of 8 to 12 misoprostol pills, and medications for pain management and nausea. The first medication is called Mifeprex. This medication blocks pregnancy hormones and stops pregnancy growth. There are not usually symptoms with this medication, although occasionally people report bleeding, cramping, nausea, or fatigue. It is recommended to wear a pad or panty liner as a precaution. Most people are fine to go about their normal day from now until they take the second medication. You may swallow the Mifeprex pill with a cup of water as soon as you would like to start your medication abortion. Please write the date and time you start this medication on your take-home instruction sheet so that you remember when you took it and can report it at your follow-up assessment. The second medication is called misoprostol, and your kit will contain a total of 8 to 12 pills. About 30 minutes before you take the misoprostol pills, make sure you take your pain medication, nausea medication, and eat a light meal. It is important that you do not swallow the misoprostol pills. You have a choice of how to take them, either in your cheek or in your vagina. If you choose to let the misoprostol pills dissolve in your cheek, you must wait 24 to 48 hours after you take the Mifeprex pill before you take this medication. Put the first dose of 4 misoprostol pills in your mouth, 2 on each side, and place them in between your cheek and gum, sitting in your lower jaw. Let them sit in your mouth for 30 minutes. After the 30 minutes, if the pills aren't fully dissolved, it is okay to swallow the rest with a sip of water. Please do not eat or drink anything while you are letting the pills sit in your mouth. If you experience vomiting after taking the 4 pills, they will still be effective if they remained in your mouth for the full 30 minutes. If you are less than 9 weeks pregnant and do not have cramping or bleeding, or only light spotting 24 hours after taking the first dose of 4 misoprostol tablets, you may take an additional dose of 4 pills. If you are over 9 weeks pregnant, 4 hours after you take the first dose of 4 misoprostol pills, repeat this process using an additional dose of 4 misoprostol pills. There will be an additional dose of 4 pills remaining, but save those in case you need them later. We will advise you if you need to take those pills. You can also choose to let the misoprostol pills dissolve in your vagina. You may start this process anytime up to 48 hours after you take your Mifeprex pill if you are less than 9 weeks pregnant, or 24 to 48 hours after you take your Mifeprex if you are over 9 weeks pregnant. To take the misoprostol vaginally, start with clean hands and insert 4 pills one at a time into your vagina as high as you can place them. As with taking misoprostol by mouth, if you are less than 9 weeks pregnant and experience no bleeding in the first 24 hours, repeat with a second dose of 4 misoprostol tablets. If you are over 9 weeks pregnant, repeat with a second dose of 4 misoprostol tablets 4 hours after taking the first dose. The main side effects of the misoprostol tablets include bleeding, cramping, and passing clots. These side effects are normal and mean that the medication is working. Experiences vary from person to person. You could start bleeding immediately, so we recommend putting on a thick overnight maxi pad before you take the misoprostol pills. If you don't experience the bleeding right away, you should begin to experience it within 4 to 24 hours. Once you begin to experience bleeding and cramping, it is usually most intense for about 2 to 4 hours. After misoprostol, you may also experience headache, fatigue, mouth irritation, if dissolved in your cheeks, nausea and/or vomiting, and possibly diarrhea. These are normal side effects and usually last only a couple of hours. It is also normal for you to experience none of these symptoms. Most people resume normal activity the following day. If you experience pain and cramping, there are 2 different medication options for pain management. The first option is ibuprofen 800. This is the same as over-the-counter ibuprofen, except it is a higher dose. It is the same as taking 4 200 milligram over-the-counter ibuprofen tablets. The second medication is acetaminophen, the same as over-the-counter extra-strength Tylenol. These pain medications can be taken on their own for mild pain and can be taken together for moderate to strong pain. We recommend taking the ibuprofen 30 minutes before you take the 4 misoprostol pills. If you are nauseous, you can take an anti-nausea medication and have a light meal at this time as well. We recommend taking your pain medications regularly as prescribed to avoid an increase in cramps and pain. The pain medication should help to lessen your pain, although it may not eliminate the pain altogether. Please do not use any medication with aspirin for at least 1 week after your visit. Other remedies for cramps and pain include using a heating pad, taking a hot shower or bath, drinking warm or hot liquids like tea or hot water, walking around if you feel uncomfortable, or massaging the abdomen deep below the belly button. Drinking plenty of fluids is also an important part of managing cramps. If the cramping or pain does not lessen with the prescribed pain medications and the comfort measures, please call the emergency hotline. Bleeding varies from person to person, but most people experience the heaviest bleeding in the first few hours after taking the misoprostol at home. The bleeding and cramping should then decrease and feel similar to a period for about 5 to 10 days afterwards. You can also experience on and off bleeding for up to 8 weeks or until you get a period. You may notice that your next period is heavier than usual, and this is normal. You should call us if you experience heavy bleeding, which is fully saturating 2 overnight maxi pads per hour for 2 hours in a row. Please note that passing clots is normal and that clots can sometimes be as large as an orange. If you have been feeling nauseous as part of your pregnancy, you should begin to see the nausea going away over the next 24 hours. Your medication abortion kit contains an anti-nausea medication that you may take as directed if you need it. We have a nurse on call 24 hours a day, 7 days a week, so if you have any questions or don't know if what you are experiencing is normal, please do not hesitate to call. If you call after business hours, follow the voicemail instructions and a nurse will return your call within 20 minutes. Infection is very rare with a medication abortion, so it's very unlikely that you would need antibiotics. However, an early sign of an infection is often a temperature. If your temperature gets to 100.4 degrees or higher, please call our emergency hotline phone number located on your take-home instruction sheet. If you are feeling sick or having nausea, vomiting, diarrhea, or weakness 24 or more hours after taking misoprostol, please call the nurse. In summary, call the emergency hotline if you have a fever of 100.4 degrees or higher, if you saturate 2 overnight maxi pads per hour for 2 hours in a row, if your pain is not lessened by pain medication and comfort measures, if you feel sick 24 or more hours after taking the misoprostol pills, or if you have any other concerns about how you are feeling. If you are interested in contraception, we can give you a prescription for the pill, the patch, the vaginal ring, or the Depo-Provera shot. If you are interested in long-acting reversible contraception, like the IUD or the implant, please ask your advocate if that method is available at the center, or they can provide you with a referral. You can also purchase emergency contraception, known as the morning after pill, from our center, or a prescription can be sent to your pharmacy. We will provide additional information on any or all of these methods, as well as when to start any of these methods when you speak with your clinician or patient advocate. We are available to help you choose what might work best for you. Thank you for your interest in telehealth services and medication abortion at the Women's Centers. Please contact us with any questions.